This is Med School Radio. Hello everyone and welcome back to Med School Radio. I want to think about a question here, and the question is whether or not you can give bisphosphonates to a patient with osteomalacia. So let's think first, what is osteomalacia? This is soft bones. So we know that there is a problem here with the bones, and we want to stop the bones from being soft and harden them. So in order to do that, we want to promote the process that hardens the bones and stop them getting soft. So if we give bisphosphonates, we're actually going to do the opposite. So let's think about this by reading what it says on Wiki. So bisphosphonates are a class of drugs that prevent the loss of bone density used to treat osteoporosis and similar diseases. They are the most commonly prescribed drugs used to treat osteoporosis. They're called bisphosphonates because they have two phosphonate groups, They are called diphosphonates. Anyway, evidence shows that they reduce the risk of fracture in post-menopausal women with osteoporosis. So why does this happen? Why is this successful in reducing the risk of fracture for post-menopausal women with osteoporosis? We have to think about the mechanism here. Bone tissue undergoes constant remodeling and is kept in balance or homeostasis by osteoblasts, which create bone, and osteoclasts, which destroy bone. So bisphosphonates inhibit the digestion of bone by encouraging osteoclasts to undergo apoptosis or cell death, thereby slowing bone loss. So we understand now that the bisphosphonates are trying to stop the osteoclasts from destroying the bone so that they can promote stronger bones. So in a patient with osteomalacia who has soft bones, if we give them something that is going to stop the osteoclasts from breaking down the bone, and we know that when the bone is broken down, it sends the calcium into the blood, into the serum, which is a good thing to help build bone in the future, then we're going to really cause this patient a lot of problems. And I was reading that sometimes a patient may present with some symptoms that could be confused with osteomalacia and osteoporosis. So if you give the wrong drug, if you give a bisphosphonate to somebody who actually has osteomalacia and not osteoporosis, you're going to cause a lot of problems. Anyway, thanks for listening, and tune in next time and we will think about another question.